So when we are talking about working with people that has gone through the experience of ill treatment or torture, especially in detention settings, we cannot talk about general kind of reactions. Everybody would have a different reaction towards this very hard situation, depending on their previous experience, on how harsh was the experience, on the kind of support that they had, either family or collective support, in the meaning that they give to this experience, both politically, spiritually. So there are a lot of elements that would determine how a person is going to react. So we cannot make a generalization, but we are going to talk about some of the elements that are common in traumatic experience. We do not use the concept of PTSD, post-traumatic stress disorder, but we want to describe how the traumatic experience work and the impacts on mental health. So when we are talking about trauma or a traumatic experience, we are talking about an experience that means a threat to the physical or psychological integrity of the person. It's often associated with experiences of chaos and confusion during the event. It can be a fragmentation of the memory, pieces that we cannot remember after a while, absurdity, horror, ambivalence, or bewilderment. A traumatic experience has also a character that makes it impossible to speak about it. It's unspeakable, uncountable. It's very, very difficult to talk about a traumatic experience. A person that has survived to a traumatic experience may feel that it's impossible to understand for others that hasn't gone through the same traumatic experience. That's why most of the time, like peer-to-peer supportive groups are the most successful tools, because people will feel easier to talk with other person that has gone through the same experience. A traumatic experience is also an experience that can break one or more of the basic assumptions that constitute a reference of the security as human beings, and very especially the belief of invulnerability and control over one's life. After a traumatic experience, the person cannot ever again trust others, or cannot ever trust that the world is a good place where to live, because feeling that loss of control over the life may lead to feel that anything bad can happen at any time. And this is a sensation that it's very difficult to take out. How this person used to think about herself or himself and the identity and the role in this world may be questioned after a traumatic experience. These are some of the most common response to traumatic situations. One is the traumatic event is associated with a mark, conscious or unconscious, but indelible. You can feel that there is a after and before this traumatic event. Feelings of alienation from those who have not lived the traumatic experience and feeling isolated. The person can also experience emotional and affective withdrawal, the difficulty to connect with their own emotions and with others' emotions. Another response is also the need to reconstruct one and again what happened and fill in the gaps in search of meaning or a new ending. And how this experience could have been different, what could I have done to make it be different, and also the feeling of guilt is a feeling very present after a traumatic experience. 5, questioning oneself and one's positions in the world. Who I am now in the world, especially when the ill treatment involves humiliating aggressions or cultural taboos that are not possible to talk about it in our cultural environment. 6, questioning basic assumptions about the godness of the human being, the predictability of the world, and the ability to control one's own life. These 3 basic assumptions can be forever broken after a traumatic experience. So, when we are going to make an interview and report the allegations of a person that has gone through the experience of ill treatment or torture, we need to take into account all this psychosocial impact of the traumatic experience. Even there is a UN official definition of torture. Torture can be difficult to define sometimes, but you don't need to do so for the purpose of reporting allegations. You must, as minimum, be able to show that severe physical or mental pain or suffering has been deliberately inflicted, or that intentional exposure to significant mental or physical pain or suffering has occurred. In the case of torture, the suffering was inflicted for a specific purpose, such as gaining information, punishment, or intimidation. Who are the perpetrators? Anyone acting in an official capacity. This might include police, gendarmes, security forces, prison officers, military personnel, government officials, or civil servants. We want to talk also about the medical settings. In countries where torture is a regular occurrence, doctors are sometimes the early witnesses when they are called to treat the resulting injuries or psychological trauma of ill treatment. In some countries, there is an area of medicine known as forensic medicine in which the doctors have a specialized knowledge of types and probable causes of injuries or disease. For legal reasons, the forensic doctor is often asked by the police or courts to examine victims of violence and should keep detailed records. While doctors may be too afraid to report cases themselves, requesting a medical file either from the forensic doctor, the family doctor, hospital, or prison doctor, if it's possible, could yield valuable information. So do never forget about this kind of medical reports when you are recording and reporting ill treatment allegations. The issues of consent and confidentiality should be always discussed in first place. Professional ethics require doctors to make accurate reports, and yet in some cases there may be strong pressure to omit findings or even falsify reports. One of the difficulties of medical reports may be that injuries are often described without listing a probable cause. In such a case, it may be possible to ask an independent expert to interpret the findings to see if they are consistent with allegation of torture. In many ways, recording the allegation of torture is the most crucial step in the entire reporting process because it dictates what you are able to do with information in the later stage. Yet it is also the one which can be most difficult either to learn or to explain in a universally applicable manner. Remember that an allegation of torture may be made by the victim himself or herself, the relatives of a victim, witnesses such as a doctor who examined the individual, or individuals who saw the victim being taken into custody or were present during the incident of torture. In all these cases, the information can be collected by interviewing the person making the allegation. When conducting an interview, you should always bear in mind the following general considerations. When making these kind of interviews, you need to balance between two important requirements, which should be complementary but sometimes conflict. One is the need to obtain useful and accurate information, and the other is the importance of respecting the needs of the person being interviewed, both about safety, physical needs, emotional well-being. So on one hand, the guiding principle should be that you are attempting to obtain the most logical, precise, and detailed information possible of the incident so as to enable you or anybody examining the allegation to understand clearly what happened, as well as to make it possible to seek verification or investigation on the information. But on the other hand, interviewers should be very careful in their questioning and watch out for signs of tiredness or distress in the survivor. They should be also aware of culturally taboo subjects, particularly everything related with sexual abuse. If we are not careful, not only may the interview become unpleasant for the person being interviewed, but it's also possible that the information may become less reliable if the person is tired or upset or stressed. So it's very important that the interviewer is very careful to do not re-traumatize the person during the interview. A balance must also be struck between the need to obtain as many details as possible and the importance of not over-directing or influencing the interview. The facts which you record should be those which occurred, not those which you suggest might have occurred. Each person interviewed, whether the victim or a relative or other witness, is an individual with a complete different story. Even if you are aware of the patterns of violations that are prevalent in this area in the greatest detail, or you are fairly certain what happened to a particular victim, you should not assume that each person would have the same story or that this person will like to talk about this. You must treat each interview as a unique record. Do not assuming and do not adding information that comes from your knowledge. Members of the documentation team might find interviewing victims of torture and other witnesses to be a task very stressful. They should be prepared to discuss their responses, their feelings among themselves, and if it's necessary, also seek for professional help. We already discussed how important it's taking care of the teams in human rights violation settings. So, how to start an interview that is careful and supportive with the survivor. First of all, before starting, you remember to review in detail all the aspects related with informed consent, professional ethics, and security. They are central to the interview process, and there are certain aspects which you need to explain very carefully to the interviewee. You should always start by introducing yourself, your organization, your objectives, in a way that it's clear, that it's not confusing. It's very important that the person understand what are you going to do with the information that you are gathering. Also make sure that the person has no objection to note taking or the use of recording machines or interpreters whenever it's needed. Address the issue of informed consent and emphasize the confidentiality of the interview itself. It is also important to do not build unrealistic expectations. You should make sure that the person understands that any potential allegation process may take time, can have some risk, and can yield limited results. With all this information, if the person agrees, then we can proceed on the interview. Should you keep notes of the interview or it's better to record? These kind of decisions may be depending on the context and the situation that you are working on. Keeping a detailed record of your interview, it's very important to ensure accuracy, but you should explain to the individual how these notes or this recording would be used and who will have access to the information contained in them. This is very important because some people must feel trust on talking with you but do not want anybody else to listen to this information, and it's very important to ensure the respect to all these kind of petitions from the person that we are interviewing. There may be also some instance what is more appropriate just to listen and make your notes immediately afterward. For example, when working in a detention center or when working in different settings where recording is not possible at all. By whom should the interview be conducted? Interviewing an individual that has gone through such a traumatic experience can be very tiring, both emotionally and even physically tiring. It is especially difficult when the interviewer is alone because it requires the ability to ask questions, listen, develop a report, handle difficult emotional situations, take notes, watch out for gaps and inconsistencies all at the same time. It can be very challenging and very tiring. When the circumstances permit it, it is the best way to interview as a pair, with one person asking the questions and the other taking notes. Even better is where the two individuals have complementary skills or previous training, for example, medical and legal expertise. This may help to ensure that no important points are missed and that the right questions are asked. In order to avoid confusion for the interviewee and to facilitate the establishment of a report, however, you should make sure that one of the interviewers has the primary responsibility for questioning, giving the second interviewer an opportunity to intervene towards the end. Sometimes, as human rights defenders, we may be working in contexts where we cannot speak the language of the person that is the survivor of the human rights abuse. So we may need the help of interpreters. This can be something very sensitive, so we want to give some tips and advice about working with interpreters in human rights violations context. First of all, make sure that the survivor agrees to the use of an interpreter and is aware that the interpreter has also a professional duty to respect the confidentiality of the interview. Second, be aware that the interpreter may find the content of the interview difficult to deal with. Sometimes interpreters are also victims of the same situations that we are trying to report. 3. Make sure that the interpreter is aware of the need of absolute confidentiality. This is particularly important if you are using non-professional interpreters. 4. Be aware that non-professional interpreters may be more easily drawn into the conversation than professional ones. It is very important to explain them before the interview that their job is to relate the interviewee's word exactly. If they have also a personal experience that they want to share with you, let them know that you can arrange a separate space to make an interview with them, but not during the interview. Another recommendation is to avoid using local persons unless it's absolutely necessary. It can create mistrust on the part of the interviewee and may also place the interpreter at risk. This applies equally to co-detainees, family members, and other relatives, and anyone involved in the situation in any way. Remember, in addition, that while family members may be viewed as supportive in certain cultures, in others, it may be highly inappropriate to discuss certain matters in their presence. For example, it may be culturally taboo for a female victim to discuss sexual matters in the presence of a male member of her family. If you or your organization are of local origin, you should probably already be aware of any of these sensitivities. Do not forget to take into account, especially in cultural contexts that you don't know very well. And of course, remember not to switch off during the interpretation of the translator. Even if you are not speaking directly to the interviewee, it is important that you keep on the connection and you keep on establishing this interest with them to show that you are connected and following up what's going on. And sometimes also in the non-verbal expressions, in the body language expressions, you will find also a lot of clues. So do not switch off during the lost in translation periods. So interviews about very personal experience, such as ill treatment, can be extremely intimidating. Sometimes you may not have much control over the setting in which the interview takes place, for example, inside a prison or a detention center. But even small considerations on your part can help an interviewee to feel more comfortable. So, whenever it's possible, try to establish a comfortable and private setting, preferably alone, unless the interviewee will feel more at ease with someone else and that person agree to do not interfere with the conversation. If the interview cannot take place in private, try to ensure at least that others are out of hearing. Also, be aware that your posture and how you sit in relation to the survivor can affect how comfortable they can feel. For example, in a confined space, leaning forward may appear threatening, while in other circumstances, not doing so may convey a lack of interest. Some may prefer to sit closer to the interviewer, others may be very protective of their personal space or shy away from being touched. Be aware of your surroundings and observe the body language of the survivor to gain a sense of what may be most appropriate in each case. It's also very important to allow the possibility of taking breaks. The person must feel that she can stop whenever need to breathe, to cry, to rest. The person must feel in control of the interview. How can you deal with people that are too afraid to talk? Some interviews may be conducted in a relatively safe space, but in many cases the surroundings would not be secure at all. This is particularly the case where interviewees are still in the custody of the authorities. You cannot ensure their safety, but you can take steps not to place individuals at a greater risk than necessary. So first, as always, make sure that individuals are giving their informed consent to the interview. Never name individuals alleging ill treatment to the authorities without their express consent. Be very careful and avoid identifying individuals, even inadvertently, as being those who have given you the information. For example, in a location with a very small number of detainees, like a police station, you should make sure to interview all detainees in the same way and not to react immediately to allegations in a way which make it possible for the authorities to identify the source of information. If you feel that an issue should be immediately addressed, for example, a police station chief, you should first consult with the interviewees and should never approach the official without their specific consent to this action. Do never ever start actions that can put at a greater risk person, especially in detention situations. Make very clear to the interviewees that if they or any of their relatives or friends are subject to intimidation or pressure of any kind as a result of the information that they have provided you, they should let you know as soon as possible. So you must ensure that you give them a card with contact details and emphasize the importance of contacting you in any of these situations. Then do your best to follow up individual cases if you feel they may be at risk in any way. Keep records of all the person you have interviewed and ask for them by name if you are able to carry out subsequent visits and follow up. So what can you do to maximize the reliability of the information? You can, for example, avoid leading questions. These are questions which already suggest the answer you are looking for. For example, asking, "Were you tortured in custody?" would be a leading question. But "Did anything happen to you?" would not. It is important that the account given by the interviewee is his own, not yours. Be very careful with that. Avoid the use of lists where possible, as they can lead to inaccuracies where the items on the list do not correspond exactly to the experience of the interviewee. So it's better to make open questions so the person can explain their own experience. Be aware that inconsistencies do not necessarily mean that an allegation is false. The interviewee must be confused, or have found your question difficult to understand, you can sometimes resolve inconsistencies by asking the same question in a different way. You may also consider that sometimes, because a traumatic experience may create fragmentation of the memory, some of these narratives are not absolutely accurate and have gaps and have inconsistencies that are exactly the proof that a traumatic experience has occurred. We need to also to think if there are any specific gender considerations to take into account when selecting an interviewer or an interview team. There is no strict rule on this point, and it will depend on the individual interviewee and interviewer. Preferences may be based on cultural or personal factors. In general, it is better to try to have a female interviewer present when interviewing a woman, especially if the account is likely to involve sexual matters. It is less clear-cut with regard to men. They may also prefer to speak with a woman about sexual matters, but in certain cultures, this would be unacceptable. Do not forget to take into account the gender of the interpreter also.